The world today is facing so many challenges. The old ones are all there, and now we've got new ones. Migration because of war, the refugee crisis, the old ones, the fight against poverty, inequality, disease. But in the face of all these very large challenges, it's also great to know that there are people at the forefront of it who are giving it a real fight. Leading from the forefront for a decade, more than a decade, are Bill and Melinda Gates, and it's a real pleasure and honor to have both of them sit down with us here in Davos. Bill and Melinda, thank you very much for being here. I was reading the blog that you guys wrote before this conference began here. You identified 3 areas where the fight is going to be, the top priorities in 2016. The fight against HIV, women and girl empowerment, and innovation, essentially. Just talk us through what does each of these 3 mean for you, and how significant are the challenges here?
Well, we have a very positive view of how the world can be improved. Whether it's health of the globe or just look at health in India, getting the malnutrition rates down, getting the survival rates up. The last 15 years, there have been a lot of progress, and there's a lot of great excitement now. The government's made a commitment to new vaccines, a commitment to more sanitation. So there's a sense of change of let's do things differently. Let's clean up these rivers. Let's change these practices. And so we're very optimistic about where things are going. As you say, there's a bit of turmoil, but India's an example where the economy is still going reasonably well. But lots to do in education and health, which are kind of the fundamental things that create the opportunities.
Each of these areas, how large is India in terms of, the
It's one of the reasons our foundation works in India is because there is still so much need, and particularly in the northern states, UP and Bihar. And the great thing, though, is the competition amongst the states. They're great role models and examples to follow. And I think the thing we've been so encouraged about is that both maternal deaths and childhood deaths are down, cut in half in the last decade. But now the government's focusing on the other pieces, the newborn health, nutrition, family planning, coming back to family planning and saying that women, what they have available in the private sector ought to also be available in the government sector. And so those are all very encouraging signs to us.
Is the institutional frame getting stronger? The support from the government, the institutions which will be there regardless of governments coming and going, are they getting stronger? How would you?
Yes, I'd say that because the digital revolution lets us measure things and say, okay, is somebody really showing up? Is somebody really being productive? Even getting the mobile number and calling somebody back and saying, hey, how long did you have to wait? Was the reproductive health tool in stock? How are you treated? There's a big challenge for India in terms of the budget for health. Right. And, as the federal level says, no, the states need to do more, will they really step up? Because, unfortunately, most health spending is still out of pocket. And a lot of the quack sector, we still haven't figured out how to raise the quality there. So I'd say the trend lines are good, but there's still some really tough problems, including budget and making sure that the quality of service, that when you go and buy drugs or when somebody says they're going to give you medical help, is it really the right thing? Does that help?
I think 2 very promising things that we've seen in the health sector is the eradication of polio in India was huge, not just for India, but for the world. And what it built in India in terms of a real vaccine system. And so now, 4 new vaccines are going to come into India, and those will save children's lives because of that system. The other thing that we see are the ASHA workers. They have been there for a long time, but now the government's really committed to make sure they have incredible training, and they're hooking up with the auxiliary nurse midwives. That's bringing a deep level of health and commitment out to the rural areas, and that's where you start to see real change. And so we're encouraged by both of those infrastructures.
The third point here, which you outlined as the top priority, innovation, right? Can you sort of tie that in with the focus on the health front on the other 2, the first 2 fights?
Well, innovation comes from the digital realm, and so that lets us help track things. Eventually everybody will have electronic medical records, and you'll just type in any concerns you have and be connected up to the right resources. But also in medicine, these new vaccines, which were just invented in the last decade, we still don't have vaccines for HIV, but we're optimistic in the next decade we'll get one. Malaria, tuberculosis, and so the biological sciences is moving just as fast as the digital sciences, and that means we can have these ambitious goals that the world set for 2030. Without innovation, those goals are not achievable. And of course, we have more countries contributing to the innovation. It's not just the United States, but now both China and India are building up. The pharmaceutical sector in China is a key partner of ours. People like Serum, Bharat, a lot of companies there that are on the cutting edge and really understand high volume, low cost.
But the kind of timelines move, favorably because of innovation, the digital revolution?
Yes, the quality of service, take something basic like are all the teachers showing up, the digital systems let you gather that information, even see who's doing the best job, and it helps spread best practices. So governance itself in a digital world can be higher quality.
And one of the things we're seeing with as ubiquitous as cell phones are becoming is even the community health workers themselves, they get their schedule for the day that's an optimized schedule of which hut they should go to first, second, and third. They also get training on their phone and they can use that training, and sometimes even the villagers will say, can I listen to it on the same phone? So there are incredible ways that digital technology is reaching out to the far remote places. We also see technology in the agriculture sector, a flood-resistant rice now, which will benefit so many farmers in UP and Bihar. So the rice, when the rains come, which they're coming more frequently, can last for 2 weeks underwater. That's a huge change for farmers, a much bigger yield. So we're seeing it across the various sectors.
The one worth mentioning is that digital money, because the central bank created these payment banks that'll go into operation in just the next few months. We think that's going to be amazing in terms of farmers getting better credit, fees for everything being lower, government payments getting to the people they should get to. So when you bring up innovation, we have a hard time holding back.
But just to take that innovation and the digital revolution, automation, for example, is such a big thing now, especially in the US. For Indian IT services companies, for example, it's really affecting them, and they're thinking about, well, how will the volume of work that they're doing, the number of people employed, how is all of that going to change? But for a country like India, at a very basic level, where there are million youth entering the workforce every month, what does digital really mean? What's the net benefit or loss? How would you assess it?
Well, we've been benefiting from greater productivity for hundreds of years, and so not everybody has to farm now, and so we can have many other services. So overwhelmingly, this innovation is a good thing. Now, governments have to shape it and make sure their training programs do the right thing. In the U.S., the number of manufacturing jobs is quite small because robots can do a lot of that. And I'd say the next 10 years it's going to happen very quickly. So the government will have to be agile to make sure those workers can move to other areas. It's not as though we don't have uses for labor. Not every kid has a great tutor, not every old person has somebody taking care of them, handicapped kids being watched after. Labor is not so abundant that we can go to a 2-day work week or something. Eventually, society will get to that point.
But in countries like India, where labor is abundant, at this point at least, right, where industry is being set up, there's the Make in India campaign program, etc., for example. What does something like this do?
Well, the key...
Is it a zero-sum game? That's essentially, if this goes as fast as it is, and you were telling me earlier that it is happening very, very quickly now.
Well, India's main problem in manufacturing is the labor laws, the land laws, the cost of electricity. It's all the basic stuff that China got done very well. So even as their wage rate went up, their efficiency meant that they didn't have to give up many of those jobs. And so China will give up some as India gets these policies right. It's one of the only, other than Africa, it's the only significant growing workforce in the world. But it won't be quite as simple manufacturing jobs in the past. So the training piece will be a little more strict than what, say, Vietnam or China had to do.
The last 20-25 days, the global economy, markets, etc., turned upside down. People are talking about it, and I'm sure that you've got that on your mind as well. What does it do? People are kind of sort of likening it to the 2008 crisis. And when you have a crisis of that magnitude, it affects poor countries the most. What does it do to a country like India, and what needs to be done? What would your advice be to the government to kind of sort of safeguard against this turmoil that we see? Because funding gets cut and the impact is quite direct, as we've seen earlier.
Well, the big change is the commodities prices, with oil being the most extreme. And for India, it's not Nigeria where oil provides over half of the government budget. For India, all these things are less expensive.
Yes.
And so it's not a 2008 type situation. There's a lot of volatility. There are some credit imbalances. But India actually has good central bank policies right now, and it's one of the healthier economies there is. And all these price drops of things that are imports into India actually are quite good news.
Bill and Melinda, thank you very much, both of you.
Thank you.
It's a real honor and pleasure. Thank you.
Thank you.